Good morning. I'm Simone Parker with the CalPERS Stakeholder Relations team, and it's our privilege today to host this event and introduce your representative to the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. It's simple. Yvonne will provide some updates on CalPERS. Following her remarks, we'll take questions as time permits. If you have questions when it comes that time, you can raise your virtual hand and then we'll call on you. You can access this by clicking the raise hand icon in the toolbar at the bottom of your screen. Once we call on you, you can click your microphone to unmute. If you need accommodations because you're unable to raise your hand to ask a question, please send a message in the Q&A so one of our moderators can assist you. If you need closed captioning, you can click the More button at the bottom of the toolbar to access this feature. This webinar is being recorded and will be posted on our YouTube page next week. If you want to automatically be notified that the video has been uploaded, you can always subscribe to our CalPERS YouTube channel. We have an hour today, so let's make the most of our time. With that, I'm pleased to introduce Yvonne Walker. She's serving her first term on our board. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, experienced pension fiduciary, state worker, and Marine Corps veteran. She's known for being one of California's foremost leaders in fighting for pension and health benefits earned by our members and retirees. So with that, I'm pleased to welcome Yvonne Walker.
Guys, how are you? It is good to be here with you again, and I'm really glad that you guys get on and are with us. I'm going to start out a little different today and just give you a little peek into my life. So May is the start of my favorite time of year. I am a spring, summer kind of gal. So that being said, about a month ago, I saw this notice for a mud run, and I thought, I hadn't done one since I'd been in the Marine Corps, and I thought, well, you know what? I can do that. I've been walking, I'm a little more fit. And so this past Sunday, I did my mud run. Good news is, two good newses. I finished and I didn't die. So yay, because that was a very real possibility in my mind. I went up to the top of the first obstacle. And this little girl who was running with her family, 7, she got to the top. And I'm at the top questioning my life choices before I go down. And she looks at me and says, "Are you scared?" And I said, "Oh, no." But in my head, I was like, "Little girl, just go down and get out my way." But anyway, I'm alive. I made it. And it is the last mud run I will ever do. But, it was fun too, because I had a group of friends doing it with me. So anyway, that's my story for this month. So as May winds down, we had a meeting this month. I don't know if you guys know the process, but we typically, the board gets the preliminary premiums for next year in May. And then, our team goes back and they're still working, getting them down and everything else. So we got those this past Monday. And so we'll be voting on them in July at our offsite. So, well, I'll let you know more as I'm able to. Our investments are doing great, which is good. You always want to have good returns. You should have seen your cost. I'm running through this real quick. I'm going to leave as much time for questions as possible. You should have seen your cost of living hit for this May paycheck. And so, yay. Okay, and then let me see. I'm just running through real quick. Our investment return was 15.4%. And that helped boost our funding to our estimated funding to 84%. And that really is great. But I know that people are, still, cautiously looking, wondering if our assets are vulnerable, in the midst of the times that we're living in. And I just want to, remind everybody that CalPERS, we're a long-term investor. So we don't, the markets dip and they rise and they dip and they rise, but we try to make sure that we're looking out over the long haul so that, there's a smoothing effect and we don't have to just jump all around and trying to do that. So that's good. And the other thing is, I think that having the total portfolio approach, which will go into effect in July, is really good for this type of model. That we are still, in our transition with CDS. Some things have been fixed, some things haven't, but I just want to remind you that we're still working on it, and we'll continue to work on it. Oh, good news. This was asked on the last call. Kaiser is going to be going into the north for us, into Nevada. And so, but that will be available for you in open enrollment, right? They're still getting all the things together to make sure that it's good. So that's very exciting. This is the first time, and it'll be really good for our members up there. And also, we have a Blue Shield expansion going in Northern California. It's always been our aim, and we're going to continue to do this, to try to expand services as much as we can. Sometimes it seems like it's slow going, but we continue to march forward. Blue Shield has formed a partnership with the Shasta Community Health Center in Redding, and it will expand access to care for members in the far northern part of North Carolina. So, even if it doesn't have a direct impact on you, I just want you to know that your turn will come, because we're going to continue to push and look and everything else. I think that's it. Oh, before I forget, so, we had an election going on. All three of our people who were running, Cecilia Wilson, the state representative, she's from the Department of Education. I worked with her before when I was at Local 1000. She has been elected as the state member representative because she was unopposed. Kelvin Palke, he's a sitting board member. He works for the San Bernardino Community College District, and he's a school member representative. And Melissa Willette, she's a public agency member, and she works with the County of Santa Clara. And their term of office will begin in January. And so I look forward to working with all of them. And I'm going to go through the questions real quick, because there's some I can answer. I had some, I was asked that they were getting ready, coming up on 65 and looking at going into Social Security and what will they have to do. So what will happen is you'll get a letter from CalPERS, reminding you to go on and register. And then at that point, you'll either roll over. They will tell you in the letter that you roll over automatically to whatever might be equivalent to what you have now. And if you decide you want to change at that point, you can. You can go online and then just change as you want. It really is a pretty seamless process, I will say. It was, I thought it was going to be a lot harder than it was when I did it. And then I will say that a lot of the things that my healthcare costs actually went down when I went on Medicare, because things that I was paying co-pays for and different things, I didn't have to anymore. A lot more of my medications were covered fully. So that was nice. And then there was a question, and this is always a question about the limits on working as a retired annuitant, and this question was, I have, they've worked as a retired annuitant for 10 years. Some have done more. And there's always a good reason, because they're fill-ins and everything else. But, part of the reasons why there are limits on retired annuitants is because, there are some districts and some agencies that abuse that and don't use them as they're supposed to, and they use them as a contingency workforce in places where they really should be hiring, right? And so, there are parameters around that. And so that's why that exists. So, all right, I'm going to stop there. I'm going to open it up for you because I'm really excited about the questions. And then, I'll throw some more in as we go along. So, Simone, let's get to it.
Let's do it. All right, Lindell, your hand has been raised since we started. So go ahead and come off mute and ask your question.
Ooh, Lindell, you've been waiting.
Hello.
Hi.
In a past session, one of the questioners said she had contacted her state assemblyman. So a friend of mine had been elected to the California State Assembly years ago. So I wanted to pass on some information from my friend when I talked to her about things I was unhappy with the change from Blue Cross to Blue Shield and the change from Optum to CBS. And
Okay.
my friend who had been elected to the state assembly in the past, she said, you can always contact your California state assemblyman, contact the state senators. They can do things, they can hold hearings. I mean, you could even ask them to set up a recall system so that people on the board could be recalled and we would actually have some way to influence decisions. So let's just pretend for the moment that all the people listening today, let's just pretend we've been elected to the state assembly and that we're holding a hearing and that you are here testifying to us as members of the state assembly in a hearing and explaining to us in much more detail than you've said in the past about exactly why you favored the change from Blue Cross to Blue Shield and the change from Optum to CVS.
Okay. And this is, understand this is just my perspective. Okay. So on the Blue Cross to Blue Shield, I favored the change because when we were going through the bid process, right? So Blue Cross, their services were going down. They were not giving us the same bang for our buck. We were going to wind up paying a lot more. Blue Shield had expanded the services that we were going to get, and they continued to work on it. And we got a better cost, and we looked like we had a better service area. And so, looking at it, I thought that was the best option for what was out there, and bearing in mind that we had Anthem for Blue Shield. I get them both mixed up when I say them, but we had Anthem for a very long time, and they had gotten comfortable with us and not as what's the right word, accommodating. And so it just seemed like the appropriate vote from my perspective.
And what about the change from, well, before that, I can just say my experience, one thing that is very irritating about Blue Shield in comparison with Blue Cross, I have acupuncture and it's not for things covered by Medicare. So Blue Cross never charged me anything and never made a mistake. With Blue Shield, they charge me a copay every month, and every month they make a mistake and fail to pay the acupuncturist. And every month I have to call, I'm going to do it today, and say, please resubmit the claim for April 11th because, again, you made the mistake. And for months they've been saying our computer system is being changed and, we hope it'll work out. Well, that's been going on for months. So in my experience, the change to Blue Shield was not good. So what about the change from Optum to CVS?
Okay, but let me just say that I know that our staff are aware of the acupuncture issue, and they continue to work on it. And though, even though it's not resolved to the way that we would like, they're continuing to work on it. So it's not like it's gone, ignored. So I just want to put that out there. And the change from Optum to CVS, again, it was the same thing. We looked at all the things that were being offered, right? And all the cost, and a lot of it for me is cost, right? What is the cost? We were told that it was if not the exact same product, it was similar. And looking at the information that we had, it was similar. Like, and there were things in place so that if there was like a medication or something that you had to take that might not have been covered or covered, there were mechanisms in place, to make sure that you could get your medication. But like with it, and that's why I voted for it because, I mean, it was a better value. That's not to say that anytime you transition, you're not going to find, there's going to be glitches, and there are. And we're continuing to work through them with CVS. They set up their own call center with us. Our team is still working with them regularly. And I just want to remind everybody, and I know it's frustrating. I do know it's frustrating, but it is helpful to us, helpful to me, if at the same time that you're calling into that you have to call and talk to the CVS, their representative, and everything else. Please drop a line. Also, call to our call center so that they can make a note in the system, right? Because we go back and we look at all of them, and there's going to come a time, when we have to reevaluate again. And one of the things that we look at is, how many problems did we have, and how did they get resolved, and what's going on? So I'd appreciate if you did both. And I know it's irritating, to have to do that for something that, in your view, might have been seamless before. But I feel like it will make it better for all of us.
Well, I certainly share your concern for cost, but in my experience, as I mentioned, the cost has been shifted from the plan to me. It was in moving from Blue Cross to Blue Shield on this acupuncture issue. On Optum to CVS, I get one of the most common medicines in the country, levothyroxine. It's a generic for thyroid. And CVS charges me 3 times what Optum used to charge for probably the most common medicine in the country. So there's another case where cost was shifted from the plan to me. So if anybody's unhappy with any of this, I would certainly urge you contact your California State Assemblyman, your California State Senator, ask them to hold hearings, ask them to consider setting up a recall election system so that members could have some way to vote out of office people who are transferring costs to us.
All right. And let me ask you something, Lindell, before I forget. Did they, and I know that you just said it was a common medication. Did they offer a different medication that would be equivalent? Did you talk to your doctor about that?
No, I didn't. In this case, I had more important medication issues to think about. I haven't got that far down the list.
Okay. Let me know if you do that though, because if there is an equivalent, right, that's that is the same thing, generic too, but won't be 3 times the cost. I would just be interested in knowing.
Thank you.
Thank you.
All right, Maria, go ahead and come off mute and ask your question to Yvonne.
Good morning.
Hi, Maria.
I've been retired, but I think I'm going on 2 years, so I just got my first COLA.
Oh, nice.
Yeah, I was very excited about it. I retired from a school district, so my COLA is 2%. But then looking at all the changes and the increases on our premium, the 2% comes to be almost nothing. I don't even come on this. Medicare, my Social Security, because I'm already collecting Social Security. I'm not 67, but I decided to start pulling my Social Security because I thought I might as well enjoy it now before something happens and not even a penny goes to my kids. So, but Medicare, yep, but Medicare also charges deducts us 202 for Medicare. Okay, so literally, I'm paying over $550 on my Senior Advantage plan. That is outrageous. When I was working, I was paying only $290, having still Kaiser. So the cost of living, either for Social Security or for CalPERS, doesn't come close. Insurances, I mean, you just talk about premium, about, you guys are about to vote. I just hope that it's not going up again, because my 2% that I just got, I know it won't cover it.
Right, right. And just as a reminder for the school districts, that is according to the contracts you have, not according to CalPERS.
Right. Now, can we still fight that?
You'd have to fight it through your organization, through CSEA.
Actually, okay. So I'll talk to the union.
Yes, yes.
Okay. Thank you so much. And I really
Okay.
appreciate all you do. Thank you.
Congratulations on your retirement. How are you liking it so far?
I love it.
Oh, yay.
I love it. Yes. Thank you.
Okay.
Thanks, Maria. Dale, you're next. Go ahead and come off mute. Are you there, Dale?
Can you hear me now?
Yes,
sure
we can.
can.
How are you this
Very
morning,
good.
Dale?
Thank you. Yvonne, thank you so very much for hosting this. I very much appreciate this. Now, I have no complaints, but I do have answers. I believe a lot of answers that will give
Help me
all of
out.
us information to work with.
Okay,
I
thank you,
just,
Dale.
this may blindside you. I apologize if it does. I just received an email this morning from NBC News that they've done an investigation into CSEA and their practices. And there's a huge report that's been made, and it's not very good. It's not very good at all. And I think if all of us were to read this report, it just came to me as an exclusive on NBC News, and the report is on the graph. I'm sorry to report the incompetence of CSEA with an official investigation.
With CSEA, the School Employees Association?
That is, yes. I have the report. It's a CalPERS America Misled Pension Report. It's a CalPERS issue.
Huh.
Well, I know, I'm sorry to have to do this, but everybody should be aware of this. The title of the investigation is CalPERS, America's Misled and Misleading Pension Leader. I'm sorry to blow this on you, but this is information that is very, very relevant to all of us. And if we would read this, you would find our answers are there. That's the summation of what I have for you.
Okay, well, I haven't seen that report, but I'll certainly look for it.
Thank you. And I would very much appreciate an input from you on this.
Okay, give me a chance to read it.
Thank you so very, very much. I'm finished. Thank you.
Okay, Dale.
Joseph, you're next on the list if you want to come off mute and ask your question.
Yeah, can you hear me?
Yeah, Joseph, we got you now.
Okay, yeah, I know I'm just another person expressing concern about healthcare premiums. I hope that they don't go up again like they did last year for out-of-state employees. We only have one option for healthcare, and that's the Blue Shield, and it went up, 13.24% last year. I'm just and like waiting on pins and needles right now to find out what it's going to be, because I think we find out in June or July.
Uh-huh.
And I mean, if it keeps going up, like, I basically am going to have to make a decision now of having to drop healthcare or something. And it's like, it's really insane that I put the years in. I'm supposed to be fully covered for medical, and now I'm facing this. I just can't. I'm already paying over almost $1,000 a month, and it's like, who can literally afford to lose between $350 to say $400 something a month every single year until Medicare? It's not how can that be possible?
Right.
I don't know.
Well,
I hope,
yeah. we'll find out in June, and we'll talk about it in June. I can't talk about it now.
Right,
Um,
right.
yeah.
And I mean, it was like, I think I talked about this before with you, when from 24 to 25, see, they switch. I think you guys switched from Blue Cross into from 24 to 25. 24 was Blue Cross, and then Blue Shield in 25. It went up like $80 a month, something like that, which I thought, okay, that's that's doable, but then this year, when it went up like over $350 a month, I almost fell over. It's like that. How could that be? And it's like, I mean, hopefully it doesn't keep increasing like that. I mean, God, my cola doesn't do nothing.
Right.
And
Right.
I speak for a lot of people out of state too. I think, they're like, how can they possibly stay retired with premiums like that?
Right. And
Yeah.
I understand that because we used to have the same uh, problem when I was at Local 1000 for out of state employees.
Mm-hmm.
And so, I mean, that the difference is we were able to negotiate subsidies, right?
Right,
That
right,
are
right.
not available to us for retirees. And that's because of tax code. Because I looked into
Mm-hmm.
that also, like, well,
Right,
maybe if we can do this, it would be,
right,
it could
right.
provide some relief. And so, but it's where we're at,
Yeah,
unfortunately.
yeah. And also it's like, CalPERS contributes, I think, something like $2,040 somewhere in that
A
ballpark
lot.
a month for my for all of our for my premium, right? Because I'm
Mm-hmm.
fully covered, so that means they'll cover 2,000. So it seemed like they need to start covering, increasing their contribution. I mean, if it keeps going up like that, it's like, you know something needs to give somewhere.
Yeah, yeah, I get that because the formula is legislated.
Right,
Yeah,
right.
and so you were like me. I was, you know, um, hired when they still had the 190 formula.
Uh-huh.
I
Yeah.
think they're at 80/20 now or something like that.
Something like that, yeah. And I don't know, but something needs to happen, because I'm just, like I said, I'm just hoping that it doesn't go up again next year like this.
Right,
I just don't see how it can.
right.
I
How
mean,
old are you now, Joseph, if I can ask?
I'm only 54, so
Ooh,
I'm a ways off. My wife's 57, so basically when she hits Medicare, then, I think what they said, the first person to hit Medicare, it's gonna change drastically, but still
yeah, because it'll be modified.
yeah, we're about 8 years off for five, yeah, about 8 years off for that, so I mean,
Uh,
we're still
yeah,
a
because it
ways.
is a drastic drop.
Oh, I know it. And I mean, a lot of people are complaining, I got to pay $300, $400 a month. It's like, man, I'd love to pay that.
Right,
But like I said, everybody else is in California last year. All the other plans in California went up, but nothing like this. And
right,
and this is the one. It's like they're punishing all the out-of-staters for moving out of state. It's like that you only get one plan, and that's the one that's going to go up, the most.
right.
It's
That's.
not
I will
fair.
just tell you that's not their intent.
Uh-huh.
And this is a self-funded plan
Mm-hmm.
that CalPERS is in, that
Mm-hmm.
they do. And part of why it went up, and I
Mm-hmm.
think if I'm not mistaken, it went up 2 years in a row significantly, was
Mm-hmm.
because at a certain point they hadn't collected enough,
Uh-huh.
to cover, and that's
Mm-hmm.
why it went up so much. And that's also why we changed the pool, um,
Uh-huh. Uh-huh.
so that to hold it down a little more.
Right, right. Okay, well, I'm just hoping it doesn't we don't see anything like we did this year or last year, whatever, I
Right.
mean, that's what I'm hoping, because I'm just like saying, if it goes up another, $400 a month or something, yeah, that's huge. That's a
That
huge
is a
impact.
major.
A major. That's like, yeah, that's like, almost, about that's about a car payment. That's what I used to pay when I had car payments. It's like,
Right.
how can any, you take on that every single year, another, no, it's not going to work.
And then the cost of everything else, trying to fit everything in with, yeah, I get it.
That's right. That's right. Okay. All right.
All
Well,
right.
we'll see in June. So you're going to have another town hall in June?
This is no, it will be July.
July. Okay. Okay. Very
Yeah,
good.
yeah.
Okay.
but the rates will be up once the board goes over it. They'll go up in June. They'll be on the website.
They'll be on the web, yeah, next month,
Yeah.
right? And who exactly negotiates these increases?
Our healthcare team.
Healthcare team. Okay.
And they're not looking to to be clear. They're not looking to negotiate increases. It's the way
Right.
it worked out. So
Right.
yeah.
Okay. Well,
And
hopefully.
I will just say, I think that having negotiated we have a phenomenal healthcare team from soup to nuts. They are great, and I will just say, I believe they're doing a great job.
Okay. Well,
Even though the outcomes are not sometimes what we all want.
Nope.
I get that too.
Yep.
But that has
Exactly.
nothing to do with the job that they do.
Okay. All right. Well, we'll see. We'll see next month. All right.
All right.
Thanks a lot.
Thanks, Joseph.
You're welcome. Bye.
All right, Stephen, if you want to come off mute and ask your question to Yvonne.
Am I unmuted?
You are unmuted, Stephen. How are you this morning?
I'm doing very well. Thank you. Thank you for doing this.
Absolutely. I get as much out of it as you do.
I hope so. I hope we
I
all
do.
do. I'm concerned about our investment portfolio.
Uh-huh.
I had a question about the investments in Israel and various Israel holdings.
Uh-huh.
The United Nations organizations have deemed what Israel is doing as a genocide. The ICC has indicted many of the leaders. They've clearly committed war crimes. What would it take to divest?
Hold on, I'm writing this down so I don't forget it.
Thank you.
So I will say that we are not, let me say this right. We are not directly invested in Israel. We are invested in funds that might have, companies that are doing things in Israel, and we are not the major partner in that fund. So I will say that this has been brought up. We will continue to bring it up. I understand your concerns. I would like to see myself, us not to be so, not to have funds there. But since coming on the board, it is it's a lot harder, right? It's going to take some time.
Right.
It's going to take some time. I would urge you to continue raising the issue. If you can get on our board calls, right, and sign up for the comment period and make these comments.
One of the board calls?
The board call, you can get them on the website, but they're almost every month, except for July will be in, but you have time for public comment, but call in, make your point and everything else, because that makes a difference.
Right.
And it helps, even though, it might seem slow and, you want action right now, but it does help. And not just you calling in, get, like-minded people to call in.
Okay. Thank you.
Okay.
And if I go on the website, it'll tell me when that's happening?
It'll tell you when it's happening, and it'll give you the login so that you can, because it's on Zoom too.
Okay.
If you're not able to be there in person.
How often do they happen?
It happens. It's normally every month, but there's a few months that we don't meet. And I don't remember them off the top of my head, but they do have the calendar.
Okay, I'll check. I don't want to.
Yeah, because I don't want to mislead you and say we're not having one, and then we do have one.
I will check. I appreciate that. Thank you.
Okay, thanks, Stephen.
Michael, you're up next if you want to come off mute and ask your question.
Hello, Yvonne. Thank you so much for hosting these.
Hi, Michael.
I'm going to go back to something I think that the first individual who spoke said in the question and answer period. I have a very similar situation as it relates to CVS and our current pharmacy benefit manager. I also take levothyroxine There is a generic for that. It's Synthroid. The problem with that is, in my case, I perform better. My labs perform better when I'm on the non-generic, and the same thing is true for my omega-3s, which with the previous PBM, which you say was getting lax and problematic, I never had a problem with. Now, even though my doctor has submitted prior authorizations for both of these very typical medications, which actually are designed to help me maintain the best cardiac health, both of those prior authorizations were denied. So if my question is, if I have one, if they're denying prior authorizations for these very routine medications, these are nothing that are brand new or ultra expensive or anything like that. I just don't understand the logic, because the provision of the medication is what keeps us from having more expensive, perhaps potentially more costly health problems down the line. And I, speaking for myself, because I can talk about my own medical issues, I certainly meet the metabolic profile that suggests I benefit from prescription omega-3s. And my doctor is, actually the chief of internal medicine with her particular group, so she certainly knows how to write a prior auth. And yet I was denied on these omega-3s. So whatever problems or whatever issues are allegedly being worked out as it relates to the PBM. I've spoken with somebody who's a lead at CalPERS on this issue, who took a bunch of information. I had an extensive call with that individual. I've spoken to CVS and SilverScript several times, and it's just, you just get the around in a circle, the bureaucratic baloney. I think that, I get the impression, of course, no one has articulated this, but I get the impression that this is all about cost containment. And some of that makes sense to me. Obviously, cost containment is important. However, the medications that many of us talk about when we come on these calls with you, they're very rudimentary and frankly inexpensive medications. So I just don't see the logic in, first of all, them even requiring a prior auth, and second, denying them when a prior auth is filed, when they are preventative and keep us from potentially having much more serious problems. And whatever's being done, I don't know what's being done because I don't have access to the healthcare team. With all due deference to you, it's not enough. I don't see any change. I see things getting worse, frankly.
Okay. Michael, let me ask you something. Did you get a new prior authorization when you switched over from Optum to CVS?
Yes, and they told us in all the BS preliminary stuff we had, where CVS talked about how great they were going to be and how accommodating they were going to be. They said, "Oh, your prior authorizations, if you have them when you transfer, will be honored." Well, I had a prior authorization for 3 more fills, and in neither one of the medications case are those prior auths being honored. I was made to go get new ones.
Okay. All right.
So that was also a misrepresentation in my view.
Okay.
Sorry that I was so lengthy, but this is
Oh,
just
no, I appreciate it. More is better. More is better.
This is just very frustrating for so
I can
many.
imagine. I'm going to look into this, Michael,
Okay.
and just see if we can maybe unplug the blockage. I don't know, but I'm going to try.
Well, again, it just makes no sense because I can only speak for myself, and I've heard several others speak on here. The medications we're talking about for prior auth, they're inexpensive medications that are designed to keep us healthier. So
Right.
I just don't see the logic in, one, even requiring a prior auth for them, and in two, denying them when a prior auth is submitted. I mean, to me, it's just designed to get you to go away and pay for your meds out of pocket.
Yeah, well, I don't think it's that, but here's what I do think. So they want you to do generics as much as possible. And I will say that for a lot of people, the generics are fine, right? But there is a certain population, right, that the generics aren't. And so they will go through, and then that's, why they get the prior authorization and they ask. But it is, I have found, and this is not necessarily relating to CVS, it's just relating just in general, that, as you go through things like this, I found it when when I was working with my sister-in-law for her SDI, her Social Security disability, that, and she had a brain tumor and they denied it like twice and we had to keep going and it was frustrated and everything else. But that appears to be the business model for a lot of companies, right? And doesn't make sense to me.
Well, and
It is.
if I may say one more thing,
Uh-huh.
in the case of my omega-3s, those are generic and they still require a prior auth, which to me is ridiculous. So and none of this is just making any sense to me. And I agree with you when you say, well, this is the business model for a lot of companies, but you guys selected this company and supposedly they were going to be, quote unquote, better. And they're getting a huge contract from CalPERS, but yet, excuse the unprofessional expression, but we're getting screwed over. And to me, that's ridiculous for the contract that they're getting.
Okay. All right, Michael. Well, I will look into this and see if we, and, for all of you who come on, I try to look into it and see if I can, remove any roadblocks. So I will.
Well, we just appreciate you taking this to the healthcare team on our behalf, because
Absolutely.
I frankly never thought I would experience anything like this with CalPERS, honestly.
Yeah, and I'm sorry that you are, and hopefully we'll get to a good place.
Thank you so much.
Okay.
Anne, you're up next.
Thank you. Yeah, so it's kind of like a broken record here, but I just wanted to, I guess my scenario in terms of premiums and the increases and whatnot. So I've been retired about 2.5 years on my medical. I have myself plus my son, who won't age out till next year, till middle of next year. And obviously I'm fortunate compared to some people, certainly out of state people, but I was paying zero for medical, like what the state contributed covered my premium. In 2025, I still had the vision and the dental. But this year I'm paying $120. And as you fully understand, being on a fixed income and having something going from zero to $120 a month with, like, I did not realize that was a thing. I did just recently look at what the premiums were for self only, and it doesn't look like my out of pocket would have changed much for that. But for folks who retire and still have dependents, that's a huge jump. And so as you guys are working toward, and I heard you say that it's legislated in terms of what the state contributions are, but just please put a note forward that folks who have one or more dependents, that percentage increase from zero to $120, I guess that's not a percentage, but the actual out of pocket increase is really significant.
I will. And did you keep the same health plan you had when you were active into retirement?
I think it had to change just because of, what went on with Blue Shield and Blue Cross or whatever.
Okay. All right.
Thank you.
All right.
Ernestine, you're up next.
Ernestine, you're still on mute.
There you go.
Yes, I didn't have any specific questions. I was only listening.
Okay.
But I
You just wanted to say hi.
I did learn something that CSEA negotiates your pay raise. I wasn't aware of that. I thought it was done through CalPERS also.
Oh, so for your COLA?
Yes.
Yes.
So how do we go about? We have to go through the union CSEA in order to.
Yeah, if you want to make changes, because it's normally in their contract. I mean, for state workers, it's legislative, but for CSEA, it's based on what the district and the contracting. So contact CSEA, your local CSEA office, your union reps.
I certainly will, because I've been receiving the 2% for 5 years.
Oh, and you'll continue, and I don't anticipate, to be honest, Ernestine, I don't anticipate that changing.
Okay, thank you.
Okay.
And thank you for
And thank you
hosting.
for saying hi.
Yes, and thank you for hosting this webinar. Thank you.
Absolutely. Appreciate you getting on.
Mhm.
Michael, you're next if you'd like to come off mute and ask your question. Looks like you're still on mute if you're talking. Oh,
Hi,
looks
Michael.
like you're off. We can't hear you, but it looks like you're off mute. Maybe we'll go to the next caller and try you again. So, Patricia, would you like to ask your question?
Hi, good morning, still morning, and congratulations on your mud run. That's very impressive. My name is Patty, and I am from a retiree chapter. I am chair in CFT, and I also serve on a retirement policy committee for CFT.
Oh, okay.
And yeah, one of the things it's a much broader question for you.
Okay.
Is we're kind of watchdogging the investments for I appreciate you saying investments are doing great and that the CalPERS is always looking for long-term investors. One of the things that has been an issue lately is private equity investors, and so we've watched companies like Toys R Us and Joann's Fabric and all of those close down because of private equity investors coming in. And I know we have a great staff at CalPERS that vets the investors. I know that Marcy Frost I've seen her in presentations talking about how, how some of the things about looking for private equity, if we have to go with private equity investors, those that have labor practices and
Right.
they will sign on to labor practices so that we can protect people and also so as we're trying to protect our money, we're trying to grow our money. What is like the board members' roles and your voice in the accountability of protecting the investments of our pensions? And also would in the future, do retirees see that there could be like a reduction in our pensions because of how we're investing our money, or if we end up losing money in our long-term investments? Does that make sense?
It does. It does. So, so our role is to set policy, right? We don't do the individual. We don't research and do the individual investments, but we set policies for what we want to look for, what are our standards. It was this board, when I got on the board, that moved our labor standards to have for investors. We were, and it was a push, right? But we felt like that was important since, we're investing working people's money, that there should be standards, right? That protect working people and the people that we invest with. So that's our role. Every board meeting, they give reports and we're asking questions, making sure that they are held up to our standards, making sure that if somebody isn't, say they, for whatever reason, they have signed off on the labor standards, and then in practice, they do something different. We made sure that there's a mechanism for us to, back out from that, if that makes sense. And so that's our role. And then you had another question?
Well, I'm curious if, say, our investments are not going well, is it at any point going to affect our pensions that we're currently receiving?
Theoretically, I mean, you'd have to have several years of really bad investments to have it impact our retirement checks. And I will tell you, before we ever got to the several years, the board would be like, oh, wait a minute, let's talk this through. Let's make sure that we're in the right place, because our whole job is to make sure, our duty is to make sure that we're making money, not losing money. And that's not to say we don't ever lose money, because we do, just like any other thing, right? It's just like the ocean tides. It comes in, it goes out. But making sure that we trying to make sure that we lose, that we're not on the downswing a lot, right? So if we had 10 to 15 years of downswings, yeah, I could see it having an impact. Do I think that would ever happen, and that any board would ever allow that to happen? No, I don't think that.
So then so as members of CalPERS pension, the pension program, then it is just, it's our voices that can be heard at election time if we feel like our money's not being invested correctly as we elect trustees.
Not only at election time, like we're doing this, and I make a note of everything everybody says. I get comments and I take it back, and I, work with them and everything else. So it's not just election time. Don't think you have to wait till every 4 years, right? I want you to make your voice known throughout. Don't, before the problem gets too big that we can't resolve it. Does that make sense?
Yes. Yeah.
And that's part of why I do these calls too. I want to make sure that I'm hearing you. I don't want anybody to feel like they have to be silent, right? I mean, I want to hear good. I want to hear bad. I want to hear where we need to improve. I want to hear all of that.
Great. I appreciate that. I know we go to your meetings in person, so our organization has, a chance to do public comment there and stuff. So we'll keep doing that.
Right. Thank you for your time. Talk to Jeff from time to time. You're the president of CFT.
Yes. Yeah. All right. Thank you so much.
Okay.
Just doing a time check, Yvonne. We have 8 minutes. Do you want me to take a couple more, or do you keep them going? All right.
Yeah, keep them going.
All right, Carl, you're next on the list. Go ahead and come off mute and ask your question. There you go. Oh, you're back on mute. Did you want to try one more time, Carl, before we move on to the next person?
How about that? Can you hear us now?
Oh,
yes, we got you now. Whew.
Is it Carol? I'm sorry.
This is no, it's Carl, but
okay.
I tried logging on. This is Karen. I'm also Carl. I'm his wife.
We're both CalPERS.
Okay, it's Carl and Karen. Okay.
Yes. We've been retired 21 and 22 years.
Congratulations.
And we have lived out of state for 20 of those. So we would just like to know that you're doing a wonderful job fielding this. And we have had very little problems with CalPERS. We've been well taken care of all these years. I'm glad to hear you're still working with CVS, because we've had quite a few problems. First of all, they never transferred any of my information over. I got that resolved yesterday with one of the people that answers the phones for CVS. But we just want to just give some kudos, because you get enough slams.
Oh, well, thank you, Carl and Carol. You know what? And I don't consider them slams, honestly. I consider them concerns, right? And if they're concerns, I think that they have to be looked at and addressed. I don't take any of it as, against me. I mean,
well, that's good.
Yeah, because honestly, if I could wave my magic wand and make everything perfect, believe me, I wish I had one.
Well, we've, we've had ups and downs. We've had medications where we've been asked to go on to generics, and some have been not approved. But usually our doctor can find a substitute medication that works for us just as well.
Right.
So we just wanted to be a positive for PERS.
Oh, I appreciate that.
We're sorry people are having trouble with meds, but for 20 years out of state, and newly retireds don't make that much on a COLA, but by the time you get to ours, we appreciate the COLAs very much. So
what state are you guys in?
We are in Idaho.
That's where my daughter is.
We have
He's
a
in
small sheep
Pocatello.
ranch. Yep, and just at the bottom of the chimney, and
Yeah.
we've been up here quite a few years, and we just kind of, you have to learn to roll with the punches.
Yeah.
Because if you look at what the people who are in private industry and don't have the benefits that we have enjoyed all our lives, that are working lives, we can understand why they'd be hurting.
Absolutely.
Anyway, we're glad you're still working with CVS to make it better. We'd like to have notifications, and like I said, we're working on getting the pills or the coverage, the meds that we need
Okay.
with our doctor. So,
All
And
right.
thank you for the encouragement that you are continuing to work with them.
yes.
Oh,
That's all we needed to
absolutely.
hear.
Absolutely.
So, thank you,
Yeah, thank you very much.
Thank you, Carl and Carol.
Karen. That's all right.
Karen, I'm sorry. I knew that.
That's all right.
I was trying to
We've
make
been
you guys
called a lot
twins.
worse.
I would rather you call her Carol than me.
Bye-bye.
Bye.
All right. I believe it's E. Achoa. If you want to come off mute and ask your question.
Hi, Yvonne. Thank you. Yvonne, I'm a 35-year state service employee, recently retired. It'll be 2 years this July. I'm echoing the concern about the benchmark financial services report that was provided to CalPERS. I'm a bit surprised, frankly, that you have not heard of this, because over a year ago, the group of associated retired employees requested information from CalPERS in order to investigate the investments. They retained Benchmark Financial Services to look into the securities and other investment holdings and issued a report. I was very disappointed to see Marcy Frost's response in the CBS, rather NBC report about this investigation, casually just disregarded. The report raises some serious concerns about the lack of transparency and concerning to me as an attorney, the conflict of interest that exists between the fund managers and, of course, we retirees, right, who are the beneficiaries of the pension fund. I hope that CalPERS, through Ms. Frost and the other CalPERS board members, seriously examines this report. It calls for an appointment of an independent inspector general to review the investments, a majority of which are, according to the report, considered sophisticated investor grade type investments, meaning, you know, everyday Joe that that work in the financial market may not be sophisticated enough to really understand the impacts of these investments and what they would have in terms of making investment decisions on behalf of beneficiaries. So I do hope that you and the other board members seriously take a look at this report. I do think it would be in the interest of beneficiaries like myself, state employees, retirees who are dependent on the pension fund, to look into the allegations and to appoint an independent inspector general to see if there are serious allegations. You may recall in 2016, the CEO of CalPERS was charged and sentenced for committing malfeasance. As CEO for CalPension, the Office of the Attorney General under then Attorney General Brown also filed suit against the CEO. So it's not like we don't have had a history of some shenanigans occurring. So I do hope that this is taken seriously. I included a citation to the report in the Q&A, but I'm sure you've seen reports of this already in the press.
Well, no, I haven't. That's what I said before. I have not seen it before coming on this call. That doesn't mean I'm not going to see it. I just have not seen it before coming on this call.
Great. Well, that would be, as our representative for state retirees, I would hope that you do take a serious look at that and work with the other CalPERS board members to seriously take a look at these allegations and not discount them like Ms. Ross did, according to the published news report that was reported.
Okay. Thank you, Ed.
Thank you.
All right.
We're at
So
11.
guys,
Okay, thanks, Yvonne. I was just going to say we're about a minute left.
yeah, so guys, we are unfortunately at the end of our time. We will have our next call in June. No, in July. We'll have our next call in July. I look forward to hearing from you. And in the meantime, please, if you need to, just contact me. All right. And so I appreciate you all getting on, and I will talk to you again in July.